Hello, Marcus Boston. Quick video today, and we're going to talk about genetics and the role genetics can play when we are analyzing an HIE brain injury for a baby. Now, the reason why I want to talk with you about this is because there is an issue that comes up in these cases, specifically when we're moving forward for litigation or we're looking to file a case against a doctor or a hospital or nurse. And so there are certain elements that we have to prove in these cases, and one element that is hotly contested in these cases is causation. Causation is really important, and so what we have to show is that the actions or the inaction of the doctors, hospitals, nurses, what have you, we have to show that their actions or inactions is what actually caused the injury or the harm to the baby. And so when genetics comes up, what happens is that the element of causation is going to be the element that the defense will attack. What they will say is that no, it had nothing to do, or your baby's HIE injury, it had nothing to do with us, the hospital, the nurse, or the doctors. It was genetics. Genetics is what caused the injury. And so I just wanted to talk with you today about genetics and why genetics is something that we have to thoroughly investigate as it pertains to these types of matters. Now, one more thing. When I say genetics, I'm meaning that genetics is actually playing a role. There was a situation in which we had in a case in the past in which the family was initially told that, well, the cause of your baby's brain injury or this HIE diagnosis is genetics. But as time went on and more testing was done, it was not genetics. It was actually birth trauma. It was something that the hospital, the doctors, the nurses, that they failed to do, namely reading the electronic fetal heart monitors and properly interpreting that information. So I just wanted to talk with you today about this issue of genetics and a traumatic brain injury, HIE. If you have more questions, maybe you're here today and you're watching this video about genetics and HIE because your baby has an HIE diagnosis, or there may be an initial issue with genetics and you're not too sure on that end, but you have questions. If that is what you have going on and you would like to speak with me further about this, what I invite you to do is to pick up the phone and call that telephone number that you see down below. I talk with families like yours all the time about these issues, and I'll be happy to listen to your baby story. What I would invite you to do is just when you call, let my secretary, let them know that you would like to set up or you like to schedule an appointment with me on the phone or my co-counsel Renee Boston, that you would like to speak with us about what you have going on, and they'll be able to put you down on my calendar and we'll be able to get to you. Now also remember, it doesn't cost you anything to talk with me about your family's story. One more thing, I practice law here in the state of Maryland, and if you contact me, because this video is on the internet and it's on social media and all of that, I can't control who watches it. If you contact me and you are not in Maryland, understand that I have to use what we call co-counsel or local counsel. In other words, an attorney in your state. And that's something that we can work with you on and try to work with you to help you with, but I just want to make sure that you understand that co-counsel or local counsel aspect of things if you are not in Maryland. All right, that's going to be it for today's quick educational video. Again, I'm Marcus Boston, and I'm one of the childbirth injury and medical malpractice attorneys practicing law here in the state of Maryland at Boston Law Group, LLC. We'll talk with you next time. Take care. Enjoy the rest of your day.